Dr. Fischler, why do medical associations tend not to support this law, and why should they?
Great question. Again, this is a moving target. So historically, whether it's based in the Hippocratic Oath, I think there's been that sense that this is outside reasonable, ethical medical behavior. I think the fear being that people might turn away from physicians if they know that we perform this. There's been a lot of shift. So the most conservative of all is the AMA, and there have been many attempts to try to get the AMA to change their position. They are still officially opposed. However, they did change their language, and I'm going to just read it to you here for a second because it's very interesting. So in 2019, the CJA, which is the Council on Ethics for the AMA, affirmed that physicians can provide medical aid in dying according to the dictates of their conscience without violating their professional obligations. So in other words, they provide an out for physicians who are members of the AMA who live in states where it's legal to participate in medical aid in dying. At this time, 12 medical organizations have adopted neutral positions. We don't expect them to come out in favor, but we do expect them to consider it a situation where some will choose this, some patients will, and some doctors will. And just like with abortion, so not too dissimilar from that. The Academy of Hospice and Palliative Medicine nationally, there is no local Arizona chapter of that, but we have a lot of palliative care docs and hospice docs who are personally in favor. Why should they support this? Because I think it makes sense to recognize that conscientious, moral, reasonable, ethical physicians support this option as something to offer patients for whom suffering is very, very difficult. One of our docs, Tom Fitch, who also gives this series, who is a Mayo longtime palliative care oncology person who was himself diagnosed with a couple of cancers in the last couple of years, has come to a recognition that medical aid in dying is a very reasonable option and cites his experience in dealing. And he said, if everybody could be guaranteed a peaceful death, we probably wouldn't need this, but that just isn't the reality. And for some of us, the option to have this be available, whether or not we exercise it or not, is a comforting thing. So I think the physician's role is to cure disease whenever possible, to prevent disease whenever possible, and to provide comfort always. For me, it's not a difficult ethical position.
Thanks.
Sure.